What is the real fact behind green tea? Does it is act like a antioxidant or act like a pro and oxidant while prevention of cancer or prevention of atherosclerosis formation or prevention of heart disease? See, like other component of fiber, polyphenols are degraded and absorbed in the colon, but the effect of such compound on short chain fatty acids production and microflora depend on the type of compound and the microorganism present in it. See, polyphenols bind protein and precipitate in the intestinal lumen, and they can increase the fecal excretion of nitrogen and fat. They also inhibit iron absorption. The antioxidant effect of polyphenols have been interest, particularly they relate carcinogens and low density lipoprotein, that is LDL. But under some circumstances, they act as a pro-oxidants. Their antioxidant effect depend upon solubility and chelating potential, but among other properties. The blacker the tea, the greater the degree of oxidation of the polyphenols and weaker the possible effect of this compound. Like herbal teas are not the real teas and their flavonoids contain is much lower. Tea contributes more than 60% of dietary flavonoids, and onion also, which is about 13%, grapes, apples, red wine, and dairy products provide most of the rest. The consumption of 1 or 2 cups of tea per day has been associated with health benefit in epidemiological studies, but catechin in green tea, especially epic electrocatechin chelate and theophylline are the from black tea, are the major substance responsible for physiological effect of tea in vitro on cells. These compounds have been shown to have pro-oxidants as well as antioxidant effects, and high concentration have been used to demonstrate effect in many cells cultures. Thus, the biological relevance in vivo of this effect is still very much in doubt, and the overall antioxidant potency of polyphenols rich beverages in the US has been measured, particularly pomegranate juice and red wine had the list, but this does not prove in vivo biological activity. And urinary metabolites of polyphenol have been measured, but at base they document intake and not biological activity. Even then, only some of the metabolites, a few isoflavones correlated, not biological activity. Even the then only some of the metabolites, a few isoflavones correlated well with intake, whereas catechin and flavonoids correlated less well with intake. Green tea contains polyphenols, flavonoid, and that account for up to 40% of the derivative of green tea, as well as caffeine and other methyl xanthines. Many health benefits like cancer and atherosclerosis prevention among them are claimed for heavy ingestion of green tea up to 20 cups per day. However, current evidence does not support or refute a definite effect of a green tea intake on the cancer prevention, even for breast and prostate cancer. Some studies show a positive effect of green tea extract on fat metabolism at rest and during exercise, and this effect has been proposed to be useful in weight loss by increasing fat oxidation, but the data are inconclusive and there are many confounding factors in evaluating the effect of tea, such as patient complaints a habitual caffeine intake, polyphenol content of the beverages ingested, and genetic predisposition to obesity. A meta-analysis of studies on the effect of green tea on a glycemic control suggests a favorable effect on fasting glucose, but no effect on insulin sensitivity. This study do not provide overall definitive support for an effect on a chronic metabolic disease and an atherosclerosis. The other major component of green tea that enhances metabolism and the thermogenic is a caffeine. However, the effect of caffeine by itself on energy expenditure are evident only at rest or with mild exercise, and effect on fat metabolism are small at best. Most of the suggestion about the value of caffeine in disease prevention come from epidemiological study, such as lower risks of type 2 diabetes mellitus with a coffee intake in the nurses' health study. As with other suggestions from epidemiological, this hypothesis needs to be confirmed by the prospective intervention trial. The data described above show only association, not causation, and thus it is not possible to recommend the consumption of large amount of phenolic as a food or a supplements until more data are available. Oxidation of LDL may play a significant role in atherosclerosis formation and has been identified as a risk factor for CVD. However, flavor rich food like olive oil, tea, red wine, soy product have not been shown to have a consistent effect of this risk factor. The combination of this product with the fruits, vegetables, and omega 3 does appear to decrease the rate of the oxidation of LDL. It is possibly that the lack of consistent effect of flavonoid supplement might be due to the variety and quantity used for a supplement of compound. Nonetheless, the data do not currently justify use of such kind of products for prevention of heart disease.